Hi, I'm Anna Struess. I'm the MR Tech at Madison Memorial Hospital, and today we're going to talk about MRI and what you're going to go through for having procedures at our facility.
Hi, I'm Kylie Thewison. I'm an X-ray student here at Madison Memorial. I'll be the patient today.
What I'm going to have you do first is pick your music for going into the MRI. It's off Pandora, so you can choose from whatever you want to. Alright, and then if you want any different color of light in the room, you can choose that. Most people pick blue because it's pretty relaxing. Good with blue?
Yeah.
Okay, so we're going to come on in here. Today we're going to explain to you how the procedure is for an abdomen MRI. I'm going to have her come over and Kylie come over and lay onto the table. You're going to be laying across this band. We use a lot of breathing techniques in MR for this scan. So I'm going to be using a little breathing machine called a bellows. It's just going to go across Kylie where her belly really rises and falls. So just breathe normally for me, Kylie. Perfect. So I'm just going to put this on Kylie, and this will help me know when she's taking in her good breaths so that I can see her on my scan when to actually do my scans. So that's on there. And next, I would start an IV on Kylie. So we use IV contrast to highlight the liver and the kidneys, all the blood-fed organs in the abdomen. And so at this point, I would be starting an IV on you. We'll inject contrast. It will be set up into our power injector. And then once that's done, I'm gonna again give Kylie the little panic button. She will squeeze that if she needs me or needs to talk to me, because once I leave this room, she can't talk to me until she squeezes the button. This is an anterior coil. It's gonna go across the top of her. It's about 2 pounds. It's plugged in to the machine. And then I'm just gonna put a little safety belt around it so that it will hold it into place. This again is like a receiver for the noise that MRI makes so that we can get the great quality pictures that we need for our providers. So this also would be the same setup for a pelvis MRI of the internal organs of the pelvis. This right here, we're going to put headsets on her. This will be where I give her breathing instructions on the outside, and it will also be where she receives music intermittently after I give her breathing instructions. Okay, how do you feel?
Good.
Good. So I'm going to put her in where she would be for a abdomen MRI. Okay. Headed into where you're going to be. Okay, right there's where she's going to be. Are you doing okay?
Okay.
Perfect. So I'm going to start the music, walk out, and start the scan. So MR makes a lot of different sounds. And so I'll just give you like some random different sequences different noises that they'll hear while they're in there. So that's basically it for the study. I'll send those images over to the radiologist. He will do the report, send the report to your doctor, and your doctor should get the results within 24 to 48 hours.
Okay.
Sometimes usually within the next couple hours, depending on how fast they're reading. You don't have to do anything to check out. You're good to go once we get you dressed. We're gonna walk out. The door at the end of this hallway is where we're headed, and we'll go get your stuff out of the locker and we're good to go.
Okay, thank you.
Mm-hmm. This position that Kylie's in right now is also the same position that we would use for a male pelvis or a prostate exam. They would be laying in the same position, and they would be in just a teeny bit farther than what she is for an abdomen because we are focusing on the pelvis and the prostate. And whatever we're focusing on needs to be in the center of the bore for good quality imaging. But this is basically the same setup. So the prep for a prostate is a little bit different. What we'll have you do is we'll have you bring a Fleet's enema with you, and 3 hours prior to the exam at your home, you're going to use 1 Fleet's enema to clear yourself out. You're also not going to be able to do any sexual activity for 3 days, no ejaculation for 3 days. We want the seminal vesicles really full so we can see them really well on the scan. When you come to your appointment, you're going to be bringing another Fleet's enema just in case we need to use it. If you're not completely cleared out, we'll put you back into the bathroom, have you use that, and then continue with your exam.